Hello everyone. In this video we will learn about one of the important congenital heart disease, which is Tetralogy of Fallot. It is the most common cyanotic heart lesion. It consists of 1. Pulmonary obstruction, 2. Right ventricular hypertrophy, 3. Overriding of aorta. The aortic valve forms the superior border of VSD. The aortic valve therefore overrides the defect and both the ventricular chambers. For ventricular septal defect. Clinical features. It is the most common symptom. It may not be present in neonates, develops only when right ventricular pressure is greater than left ventricular pressure. Fallot spells. Cyanosis after feeding or crying. Older children. Failure to thrive. Digital clubbing. Polycythemia. Tet spells, Fallot sign. To relieve symptoms after exertion, the child will squatting. Squatting will increase systemic vascular resistance, i.e. afterload, which helps shunt blood from right ventricular to the lungs instead of aorta, decreases right to left shunting. Murmur. Ejection systolic murmur in the pulmonary area, left upper sternal border. Diagnosis. Echocardiography. It is the diagnostic modality of choice. ECG. Right axis deviation plus right ventricular hypertrophy. Chest X-ray. Hypertrophied right ventricle, boot-shaped heart, hallmark feature. Diminished vascularity in lungs. Treatment. Definitive surgery. It involves total correction of the defects. It should be undertaken prior to age of 5 years. Definitive surgery. Palliative surgery. It is done when pulmonary arteries are too hypoplastic. It involves creating an anastomosis between pulmonary artery and subclavian artery. This improves pulmonary blood flow and development, for later definitive correction.